House. I'm presenting social, cultural and economic determinants of maternal health in Ado-Ekiti, southwest geopolitical zone of Nigeria. I am Dr. Pius Izundu, Department of Public Health, Texila American University, Guyana. I want to give my summary considering the limitation in time. Maternal mortality continues to be a major challenge to global health system. The vast majority of maternal deaths are preventable. This research aimed at investigating socio-cultural and economic determinants of maternal health in Ado-Ekiti. A cross-sectional epidemiological study carried out among 418 female respondents of reproductive age group, which determined the association between the independent variables: maternal educational status, maternal religion, maternal occupation, decision maker for the commencement of ANC, that's antenatal care clinic, and healthcare availability and accessibility, and the dependent variable choice of ANC provider. The mother age group was 51 years and above, that made up of 24.4%. The majority of the participants, 45.5%, were married. Also, majority of them had tertiary education, that's 31.1%. The religious affiliation of the participants was assessed, with the majority, that's 216, making 51.7%, self-identify as Christians, and 188, 45.0% as Muslims, while traditional faith constituted 3.3%. Those employed were 178, that's 42.6%, while 24.4% were not employed. Students constituted 82, which is 19.6%. Apprentice, 13.4% of the respondents. All the variables tested gave a statistically significant value of P less than 0.05. The selected variables for multivariate logistic regression also gave a statistically significant value of P less than 0.05. And we found out that strategies focusing on improving maternal educational status, creating employment, and encouraging accessibility to healthcare facilities may make a significant impact in reducing maternal mortality rates in the studied population. So the poorest nations of the world bear the greatest burden of maternal deaths. Nigeria is part of these nations. The probability that a 15-year-old female will die eventually from pregnancy or childbirth is over 200 times in developing countries when compared with developed countries. World Health Organization 2007, MN 2007. A woman in sub-Saharan Africa has a 1 in 16 chance of dying in pregnancy-related causes or childbirth compared to a 1 in 4,000 rates in a developed country. UNICEF 2010, this is a very high margin. Ado-Ekiti in southwest geopolitical zone of Nigeria is one of the poorest state capitals in the Federal Republic of Nigeria. She is burdened with high maternal mortality rates in the face of low socio-economic activity, and it is even now more serious when we are talking about economic recession, which is biting hard in most parts of the country now. This untoward situation calls for measures that will improve the lives of females generally, and particularly those within the reproductive age group. In this part of the country, no one had really conducted research specifically on the socio-cultural economic determinants of maternal health in Ado-Ekiti. That's why this study was embarked upon. Ado-Ekiti, Nigeria may have some definite and country-specific determinants of maternal health, which, if given attention, may drastically reduce maternal mortality and morbidity. The socio-cultural determinants of maternal mortality refers to socio-cultural factors such as social, cultural, and environmental conditions, living and working conditions, and community influences that promote and worsen the maternal mortality or adversely affect maternal health. Now, maternal health encompasses the healthcare dimension of family planning, preconception, prenatal and postnatal care in order to reduce maternal morbidity and mortality. World Health Organization UNICEF 2010. The impact of the burden of maternal deaths has been recognized by the United Nations, and goal number 5 of the Millennium Development Goals (MDGs) is to improve maternal health. UN 2000. Also, topic 5 of Sustainable Development Goals is to achieve gender equality and empower all women and girls. Now we know that MDGs have come to an end in year 2015, yet the questions have not been answered as per maternal health. Now we have in place Sustainable Development Goals to achieve gender equality and empower all women, but we know that some countries have not fully keyed into it for the reason that the financial muscle to achieve this is not there, owing to the present daunting economic recession. So we have earlier mentioned that the burden of maternal death is borne by the poorest nations of the world, where the probability that a 15-year-old female will die eventually from pregnancy or childbirth is over 200 times greater than in developed nations. So we see that the progress of things we are seeing, it has to be addressed even with more seriousness in the face of economic recession. If maternal death might have been determined by factors other than medical causes, as earlier observed. Now we see a picture here. The goal, what we are aiming at, is to see that no woman should die in pregnancy and childbirth. Both pre, intra and postnatal aspect of the life of a woman must be taken care of in order to achieve the vision that the world has today. Research method used. The research design and approach. Rather, this research was a quantitative study which is characterized as a cross-sectional method as suggested by Cochran, Baker and Rose 2003, Chokin and Dinelli 2006, Bruce, Pope and Stanistri 2008. Essentially, cross-sectional studies, the survey like this are a useful way to gather information on people's knowledge, attitudes and practices about some health-related issues. They are deemed as a snapshot observational or descriptive epidemiology conducted on representative samples of a population to generate information about a point prevalence estimation of health-related states and conditions to demonstrate association. The instrument we used was a semi-structured, easy-to-read hard copy survey questionnaire. It was distributed to participants in Ado-Ekiti, Nigeria, and the tools covered main issues related to socio-cultural and economic aspects of women of reproductive age group. It also touched elements of availability and accessibility of healthcare. And you see, using SPSS, Statistical Package for Social Sciences, Statistical Software, version 17, the investigator ensured that the reliability of the tool was greater than 0.7. A pilot study was also carried out on a portion of the study population which ascertained the easy accessibility of the instrument prior to the main research. Setting and sample. The participant sample was drawn from the heterogeneous city of Ado-Ekiti, the capital city of Ekiti State, Nigeria. The method continues. The population under study was women of reproductive age group who reside within Ado-Ekiti, Nigeria. Sample size was calculated. We can see it, and we had a sample size of 418 subjects. The sampling method and frame, a known probability sample of women of reproductive age group, was employed to meet the estimated sample size. Women of reproductive age group in Ado-Ekiti, Nigeria constituted the sampling frame. Data collection procedure Recruitment of potential participants for this study was done primarily at faith-based organizations such as churches and mosques, where majority of participants assemble for worship and social activities. Also, many markets in Ado-Ekiti were used. We have our inclusion and exclusion criteria. Inclusion criteria: people, women of reproductive age group who reside in Ado-Ekiti and were present during data collection. Then exclusion criteria: children, men, and elderly were excluded. Also, mentally unstable, the insane females and the seriously ill people were excluded from the study. Data was analyzed using SPSS. All survey data was coded and entered for computer analysis using Microsoft Excel spreadsheet and eventually transferred to SPSS version 17 as school software. Ethical issues. Here we observe the 4 pillars of medical ethics, which are autonomy, non-efficiency, beneficence, and justice. Graded 1977, they were adhered to. Although the study was free from any serious ethical issues, the researcher painstakingly designed a participant information sheet that explained the voluntary nature of the study in details and the anonymity and confidentiality in the study. The investigator upheld the highest ethical standard when collecting data. Results: I have to marry the result with discussion because of the time frame. A total of 48 questionnaires were distributed, and when they were returned, they were analyzable.
Hello, Mr. Pius. Yeah, you got another 3
more minutes. Hello, I can hear you.
You got another 3 more minutes.
Okay, thank you.
Okay, please continue.
All right. So here is the result. The independent variable: maternal education, maternal religion, and also they were significant. They were statistically significant because P was less than 0.5. And we see the mother age, the socio-demographic data of the participant, which we have earlier mentioned in the summary. So the tested independent variables, they were statistically significant, including the decision maker for the commitment of antenatal care. You see, in this part of the world, we know that in most developing countries, the decision maker for the commencement of antenatal care tilts towards men as the head of the family. As earlier observed, family and religion have strong influence on culture and often determine the level of women's accessibility and utilization of health care, as observed by the studies displayed. Healthcare availability and accessibility was also studied, and we found P to be less than 0.5. Maternal occupation was also significant, also in support of some studies as displayed. Now, conclusion: maternal educational status, employment, religion, decision for commencement of antenatal care, and healthcare availability and accessibility were found to have statistically significant association with maternal health in the study population. Strategies focus on improving maternal educational status, creating employment, and encouraging accessibility to healthcare facilities may make a significant impact to reducing maternal mortality rate in southwest geopolitical zone of Nigeria. Now we have future steps. This study has already made a recommendation relating to religion and decision making for ANC and other aspects. So this research has only scratched the surface of the influence of the study's socio-cultural economic determinants of maternal health among the reproductive age group in Ado-Ekiti, Nigeria. Further studies using a more pragmatic approach will give more details as per the degree of influence the studied factors have on maternal health. Then we have our references. You know, it was in details as cited in the write-up, and that's it for now, and I say thank you and God bless you.